I'm Joe Calderoni, Senior VP for Communications here at Mount Sinai South Nassau. I'm glad to say that we are back inside our conference center. During the height of the pandemic, we were doing a lot of Facebook Live events outside the building for safety purposes. This space where we are now was used for storage, for personal protective equipment and all types of other supplies that we needed during the height of the surge, but we are returning back to more normal operations here at Mount Sinai South Nassau. So I'm very glad that we're able to do this once again inside our conference center. I did just want to start, before we begin, we're here today, of course, to discuss the findings of our latest Truth in Medicine poll, which covers people's attitudes towards the COVID pandemic. But before we begin, I did just want to pause for a moment and have a moment of silence for George Floyd and all those who are peacefully fighting for racial justice. So if we could just pause for a moment. Thank you. So as I said, we're here today to discuss the findings of the latest Mount Sinai South Nassau Truth in Medicine poll. Before we begin, I do have to once again thank our sponsor, Bethpage, who've been very generous in their support of the poll. We've been doing this for the last 2 years now or so, and they've been with us every step of the way. Again, thank you to Bethpage for their support for the poll. The poll is conducted by an independent polling agency, LJR Custom Strategies. We polled 600 residents throughout the metropolitan area, both New York City and Long Island. It was conducted May 11th to the 14th via both landline and cell phone. Has a margin of error plus or minus 3.9%. And again, very grateful also to our polling outfit, which has been with us since the beginning. I want to introduce our panelists today. Dr. Rob Sharma is our Chief Medical Officer here at Mount Sinai South Nassau. And Dr. Glatt is the chair of our Department of Medicine, and he's also our Chief Infection Control Officer and epidemiologist. I want to thank them for their participation, and they also have been with us since the very beginning of our Truth in Medicine poll effort. So with that, I'm going to introduce Dana Sanneman, who's the director of our Truth in Medicine poll effort. Dana?
Thank you. Let me just pull up our slides. So when we started out the poll, we did a poll in February, right before the pandemic, towards the end of February, still flu season, and we were gauging people's opinions on coronavirus. Again, we hadn't even had any cases in the hospital at that point. So this poll now as a follow-up just was also to measure the public's opinion from when we did the first poll to now. And the most important findings, there are a lot of interesting findings, but we really had good information on vaccines and also people's opinions on reopening and how they're managing their families during the pandemic. So first, on the possible vaccine, so we polled 600 New Yorkers, metro area New Yorkers, as Joe said. And when we polled in February, 55% of the respondents were in favor of a vaccine for coronavirus if one were to be available. Now, we're finding that only 45% of the respondents would be in favor of a vaccine. And the biggest drop in interest amongst the respondents were among Black respondents, women, and respondents who are between the age of 35 and 64. 65 and up respondents were, their interest in the vaccine was steady throughout both polls. This is just a chart to show you some of the demographic breakdown. We polled a lot about the new normal, how people felt about now that we're in phase 1 reopening, about to enter phase 2, how do people feel about going to sporting events, using mass transit, and we found that 2/3 of the metro area residents will not return to sporting events, movies, or use mass transportation, even with safety measures in place. A majority would not fly or eat out. Outdoor activities were a little bit more tolerable, but again, residents expressed that it would take a while before they felt comfortable. Handshakes, 86% of the respondents said they would not offer a handshake now under any circumstances. There were some activities where people felt more comfortable, and a lot of them were about medical care. So 78% of our respondents would go back to a routine doctor's appointment. 70% said they would only do so with appropriate social distancing. Similarly, 71% said they would go to an emergency room, 63% with appropriate social distancing, 61% would go back to work, 52% would go to a beach or a park. Again, this is just a chart that broke down all of the specific questions we asked about resuming normal activity, going to religious services, going to a movie theater, all included. We asked about masks. As you can see, we're still all wearing masks, and nearly all of our respondents report that they will continue to wear a mask until circumstances change. And they kind of broke down their opinion. They'll take direction from the governor. They'll wear one as long as there are cases in their area. And we put on the bottom just the different kinds of masks that people are seeing, and we also have them on display here in the front. So we have N95 masks, K95, surgical masks, and homemade masks, and I think Dr. Glass is going to speak a little bit more about that when he comes up. Returning to school, this is a big question. Kids have not been in school now since March, and a majority of parents say they will send their children back to school in the fall if appropriate social distancing and sanitizing practices are in effect. I think Dr. Sharma will speak about this. The governor did announce yesterday that summer day camps can resume, so I know there are a lot of questions. Parents do have a lot of questions about sending their kids to camp and then back to school in the fall. Here's our chart here. And the resurgence, will there be a resurgence in the fall, and what is the public's thoughts on resurgence? So on a scale of 1 to 10, 1 is not concerned, 10 is extremely concerned. The mean was 7.71% of people who are concerned about a resurgence in the fall. So I'm just going to ask Dr. Sharma to come up and discuss a little bit more about how to stop the spread of COVID during reopening and some social distancing practices that we have in place.
Just before Dr. Sharma joins us, I just did want to remind everyone on our Facebook audience that we will be taking questions. So please feel free to post your questions. And as soon as Dr. Sharma and Glad finish, we'll be taking your questions. Send them in. Dr. Sharma.
Thank you, Joe. Thank you, Dana. So let's start with probably the most pressing question, which is day camps. I think a lot of parents have concerns about sending their kids to day camp, and what does that mean? And how does that relate to school? Because schools will open in the fall. And what we're seeing is across the globe, countries are opening schools. Since April, we've seen many countries have started opening schools. And although they haven't opened them countrywide for the most part, they are doing it geographically, region by region, depending upon the COVID status of in those regions. And what they've experienced has been from school is that with proper social distancing and hygiene techniques being applied in the schools, they're not seeing a significant spike in COVID cases in these countries where they've opted to return children to school. And many of the schools that have opened are for younger children. And part of that is because people who need to be essential workers and go back to their jobs, they won't have childcare if they don't have school. So I think that's part of the conversation. Having said that, day camp is a different setup altogether. I think it's very hard to maintain the same level of scrutiny and control in a day camp that you can administer in a school. Certainly you can reduce class sizes for the purposes of giving social distancing. Certainly people can wear masks, but it's very hard for me to imagine that at a day camp that those applications would be as robust as they would be in a school setting, where discipline is more expected from the children as opposed to going to a day camp, which is for fun. So I think we will learn a lot this summer about what happens when kids get put back into the same space and whether or not it's truly a concern for the spread of the virus. The only reassuring information we have from the other countries is that it doesn't seem to spread as quickly amongst younger children, kids under 12, as it does amongst older adults. So there does seem to be a difference in how the virus behaves, both not only in how sick kids get, but also in how quickly it seems to spread in that age group. So we will learn more as this day camp opening occurs. From a safety perspective, I think every parent has to make their own decision as to what their needs are and manage their risk-benefit analysis. But I'm sure that they will have certain social distancing and hygiene protocols in place. But without specific familiarity, I'd be unable to comment on specific situations. Now, the other thing we learned a lot about in this survey was the people's perceptions of what the new normal is going to be. And one of the things that really struck out was that the vast majority of people, 86%, said they were not shaking hands. And I think that's actually a very good sign. Many years ago when this poll first started, Dr. Glatt and I talked about how in flu season, not shaking hands was an important element to reduce the spread. And culturally, it's such an important part of how we greet one another in the U.S. and certainly in Western civilization that it's very hard to imagine that we wouldn't shake hands. But we very quickly overcame that during this pandemic period, where handshaking is really not as common as it was. And you can see by the poll respondents, people don't want to go back to shaking hands. I think that's an important element of personal hygiene and safety. And if it maintains beyond COVID, it'll actually have benefits every flu season, every cold season. So there are unlimited benefits to us adopting new greeting methodologies, whatever that turns out to be. Sporting events, interesting that most people, 2/3 would not go back to a sporting event, movie theater. Sporting events, many are outdoors. And you would think, oh, I'm outdoors, it's safer, but people still feel unsafe about it. And really it has to do with proximity. Most sporting events, people are jammed in right next to each other, and by the middle of the game, many of the attendees are intoxicated, and so any kind of mask wearing or other social distancing is probably going to fall by the wayside in many instances. So I think people's responses reflect their experiences in the past with going to sporting events, and they would not expect it to be a safe environment. We need to learn more about how that will be organized going forward. So whether they will limit the amount of attendees or limit the amount of alcohol they serve, et cetera, that may help us return to sporting events in the future. But right now, most people are not comfortable doing that. And then about half people said they wouldn't go back to restaurants. And I think the challenging part of that is most restaurants would only be able to seat half of their normal seating capacity if they wanted to maintain social distancing. So the fact that half of the people aren't going back is probably okay, because that'll help limit the number of people in the restaurant to begin with. And then finally, one of the important things, I guess, would be mass transit and how people get back and forth to work. Mass transit is challenging. People show they're not comfortable cramming into a subway car full of other people. And probably wearing masks, the surgical masks that we wear, and being in a contained environment for that long is, I would say, is ill-advisable from an infection control standpoint. And so without understanding how they would organize mass transit social distancing, it's hard to say whether people can return safely or not. So we need to understand how, let's say, the MTA would set up mass transit, a number of trains or buses or whatever it is in terms of ridership, and how it would affect the maximum number of people allowed on a car, let's say. Finally, healthcare. This is an important part of our survey, and what was reassuring here was that most people were comfortable going back to healthcare, 70 to 80%. So this is an important number because we've seen a lot of individuals who were harmed as collateral damage of the COVID crisis because they never had COVID, but their other healthcare issues were unaddressed during that time out of fear of catching COVID at the hospital or their doctor's office or the emergency department. And this creates a whole second wave of injury that is unrelated at all to having the viral illness. So it's good to see that people are certainly able to perceive that there's safety in the hospital, safety in their doctor's office. And I will say from our perspective, we've gone through great lengths to make sure that our patients and our staff are safe, that our waiting rooms are not full, so that people are being texted when to come from their cars in the parking lot when possible. As examples, in the emergency department, we are triaging and screening people outside of the emergency department, and if they have any signs or symptoms of COVID, they are put into an area away from other patients so that we could, again, keep patients and staff safe. I think the poll does reflect appropriate apprehension and concern and safety concerns from our respondents, and I'm comfortable that we have a good representation of what most people in the area probably feel. And you can see that by going anywhere. People are pretty compliant with wearing masks and social distancing, so I think people have really gotten the message, and this reflects how the message will be a long-lasting one. We're going to talk a little bit more about vaccines and other items. I'd like to invite Dr. Glad up to the podium, and he has some comments to make about some of the other elements of the poll. Dr. Glad?
Thank you, Dr. Sharma. Thank you, Joe and Dana, for again putting together such a wonderful Truth in Medicine poll. So I'm going to address some of the aspects of the poll that I think are maybe surprising, but are, I think, tentative. And the first item that I'll address is the vaccine interest. And surprisingly, on the surface, people were a little bit more interested in taking a vaccine during the beginning of the crisis than they were towards the end of the crisis. Both numbers are relatively low. And I'd like to think that that is in part due to the fact that we don't yet have a safe and efficacious vaccine in front of us. But if we were to have a safe and efficacious vaccine, an effective vaccine in front of us, and there was still a significant concern of risk of COVID, I'd like to think that the vast majority of people would run forward to take that vaccine, especially the people at highest risk. And the Truth in Medicine poll did suggest that older patients who historically are more familiar with and are more accepting of vaccines because they saw the tremendous destruction that these viruses that they're being vaccinated against could cause. They lived through polio. The older adults lived through smallpox. And they understand how tremendously destructive those vaccines are. They saw what society looked like without vaccines, and they're much more appreciative and much more accepting of vaccines in general. And fortunately, they're the group that needs the vaccine the most. Sometimes, unfortunately, the vaccines don't work as well in older individuals, and that obviously is the big unanswered question. Assuming, and it's not an automatic, assuming that we do get and develop a vaccine that is both safe and effective, I think most people will be readily coming forward to take it, despite the fact that our polls didn't suggest that everybody would be jumping to take it. And I think you're talking about an abstract situation where people aren't really given all of the facts. We asked the question, would you take a vaccine if it was available, without going into the safety issues that people legitimately have? I'm a fan of taking appropriate, safe vaccines. I'm not a fan of taking every vaccine that's out there. That would be actually wrong. I'm not a fan of taking a dangerous vaccine. That would be silly. But assuming we can develop, and I doubt we'll have it in 2020, the most optimistic hopes where we might have something towards the end of the year. I think realistically, if we do develop a vaccine, it will more likely be in 2021. Even that's not a guarantee, despite the fact that there are 100 companies at least working on vaccines, and there are many different approaches. And we have unbelievably better technology now than even a year or two ago, and certainly more than 5 and 10 years ago, in terms of developing vaccines efficiently, rapidly, being able to mass produce them and to demonstrate safety. Even with all of that, I can understand a certain hesitation. But some of the hesitation is still just the general anti-vaccine approach that's out there, which is not scientific. I understand the emotions of people. I know somebody that they claim had an adverse reaction from a vaccine, and I understand why people legitimately are asking questions about a vaccine. But if and when we prove that a vaccine is safe, and especially in such an illness like COVID-19, which can unfortunately be so rapidly spreading, and we've seen in our community how tragically disastrous it could be with the deaths that we've had at the hospital in Nassau County, in Long Island, in New York City, and across the country, across the world. Hundreds of thousands of people have died So if a vaccine can be developed, I think that the numbers that we saw in our poll will actually be much higher in terms of acceptance. Again, I think that the proof will be in the pudding when we get a good, safe, and effective vaccine. More to come on that, hopefully in a very positive way. The next thing I'd like to discuss is, will we have a resurgence? And I will tell you right now, no matter who you are, if you claim you know the answer to this question, I'd like to know what you're smoking. Because nobody, absolutely nobody, can tell you with any certainty whether we will or will not have a resurgence. There was just a study published in Clinical Infectious Diseases, one of the major infectious disease journals, which showed a very slight improvement with the weather. And therefore, as the weathers go above a certain temperature, as we're entering now into nice warmer weather, we can expect a slight decrease in the virus, assuming no other factors were being done. There was no social distancing, there was no masks. We would still expect a slight decrease in transmissibility based upon the weather. Therefore, anybody who says that we can guarantee that whatever will happen during the summer, with all of our maximal social distancing and wearing a mask still pretty high, and with people still very much afraid, and a week or two ago, five weeks ago, when we still had such a huge population in the hospital, and that, thank God, has been steadily decreasing to the point where we're rarely seeing new admissions coming in. They're down to a very, very small number. Assuming that we do have a lull now, nobody can predict that when all the social distancing does relax further, when things open up, as Dr. Shaw mentioned, when camps open up, when people start going in larger public gatherings as the state and county regulations allow, what will happen is a total guess. We hope that people will still pay attention to appropriate social distancing and mask wearing, and that will hopefully mitigate, decrease any slight potential for an increase in cases, and we'll watch it obviously very closely and cut back on some of the openings if, heaven forbid, there is a resurgence. But nobody can predict that there will or will not be a resurgence. Hopefully, we have much better diagnostic tools. It's easier to get tested. It's something unknown what antibodies represent still at this point, but certainly it's good to have antibodies. There is a potential that they may represent that you won't get COVID again, you can't transmit COVID. So as more and more people have been exposed and have evidence that they may be immune, as our ability to treat improves, it was just a paper suggesting that maybe we'll have an inhalational therapy of remdesivir, which has been shown to be somewhat effective. And if we could give that without having to come into the hospital for an IV, that would be a major benefit. It's a ways off still. As other drugs are being looked at that can be taken orally earlier on, as plasma therapy, which we're doing here at Mount Sinai South Nassau, and has been shown to be beneficial. So we have more things that we can do to help people to get sick. We can hopefully diminish any resurgence that might occur. And then, of course, the hope of the vaccine can really make a huge dent in whether there'll be a resurgence. But it's absolutely unknown at this point in time what the summer will even bring, and certainly not what the fall and winter will occur. And again, we will look forward to a vaccine, but we do have a vaccine against influenza, and it's very important that people remember that we should take the vaccine against influenza in September and October when that comes out, because that will be very important. Finally, the last thing I was asked to address was hand washing and masks to prevent the spread. You can see on the table there 4 different types of masks that people can use. Now, most of them are for healthcare workers. They're really not for the community. There are 2 masks there that regularly should be used by everybody in the community. Either the surgical mask that I'm wearing, which are the light blue masks that you see on the table, or the cloth, thank you, Vanna, or the cloth mask all the way at the far end, which can be stylistically and sartorially useful for people to embellish their look. Both of those are fine. If you don't have one of those masks and you have a scarf, you can put a scarf over your face, especially as the weather gets cooler. That might be a perfectly good alternative as well. The masks that we're asking the public to wear are basically to block any virus that you may unknowingly have from being spread throughout the environment around you. And they will be effective in doing that to a large extent. Not perfect, but effective. And likewise, they may have some benefit against you picking up something that's in your immediate environment as well. For healthcare workers, and I stress really only for healthcare workers, sometimes, not all the times, a surgical mask is still fine for most healthcare worker situations. There was a misunderstanding, I think, of a paper that was published earlier this week in The Lancet, which got a lot of attention in the lay press, unfortunately, inappropriately misinterpreted. It is not proven that for general usage that a N95 mask is better than this mask. But for specific situations in the hospital, we do recommend the first mask there, which is an N95 mask, or possibly the next mask there, not the light blue one, but the tinted white mask that's a KN95. These have a higher filtration capacity than a typical surgical mask. And they should be used by healthcare workers when they're engaged in types of encounters with patients that are especially likely to transmit virus. So that's the presentation that I have. One last question I think it was asked to address churches and temples and mosques. When can we go back to normal services? So I think that's obviously going to be dependent upon what the local governments allow, which they do now allow religious gatherings of up to 10 people. And it will also depend on what each religion's activities consist of. And they should obviously be done with guidance from medical experts and the religious experts to make sure that they're done in a safe and as appropriate for the religion and as appropriate for the science capability. And they can be done safely if they're done appropriately with medical guidance. And I think that's extremely important for people to get back to their religion for the gatherings that their religions require or recommend. And I think that's very good for the emotional health, the spiritual health of our communities, each person according to his own desires, wishes, and religion with medical guidance. So thank you very much for listening. How do you want to do the questions?
Dr. Glad, if you just would stay with us, and if I could ask Dr. Sharma to come up, because this question is for him. We're going to, if you could just come over here, Dr. Sharma. Dr. Glad, stay. We only have one, so that's why we got to do this. So for Dr. Sharma, we do have some questions. Keep them coming. We've seen thousands of people across the metro area, many of them young people, who are demonstrating for racial justice in the wake of the recent events. And the question is, some of them have masks, some of them don't have masks. What advice would you give to those folks who feel strongly about this issue, rightfully so, and who are out there taking it to the streets? What advice would you give them to stay safe?
Well, certainly these nonviolent protests are an important part of our society, and they really do drive forward social change. So we wouldn't discourage that from occurring. Having said that, trying to protest in the midst of a pandemic can be a challenge on its own. And I would not encourage anyone to be in a mob-like grouping of people without proper face covering. And when I say proper face covering, in this instance, I think a mask at a minimum would be what I would recommend. Certainly, it's going to be challenging to maintain social distancing in those environments, and so to the extent that you can at least wear a mask, that's important. And what we've seen, fortunately, is that many of the protesters are wearing masks because they're not there to put themselves in risk. They're there to promote social change, and I think that they are taking the right way to do it by peacefully protesting and protecting themselves at the same time.
Dr. Glatt, maybe you can handle this one. So the weather is warming up. We've all been inside for a couple of months. We're anxious to get out and see family. Is it safe to have family who doesn't live with me come over for July 4th or any summer holiday weekend?
So I think it's extremely important for mental health of people to get out of their houses. COVID-19 does not mean you have to stay cooped up in your apartment, in your house, and not leave the apartment, not leave the building. It's very healthy and important that people exercise and get out. When you're going outside and you're just with the people living in your household and you're not coming into close proximity with anybody else, have a mask available, but you don't even have to wear it in those situations. It's only when you get within any close proximity. And we use 6 feet. I use a much better number. I say 10 to 15 feet. If you're getting near people, why take a chance? Because we just know human nature. You're sitting and talking with somebody, you didn't hear what they said, you inch forward a little bit. You inch forward a little bit, and before you know it, you're within the 6 feet magical number radius, which is a made-up number to a certain extent. So if you're walking by yourself with your spouse, with your kids, who's ever living with you in the house, I don't think you need a mask either. But when there are other people walking, put the mask on. And certainly if you're conversing with anybody, you're getting close to anybody, absolutely wear the mask. When other people outside your, quote, bubble, outside your house, and you're getting together with them, there are safe ways to do this, but they require masks and social distancing, and it's much better to do this outdoors. I miss my grandchildren very much. I try to get together with them. They stay on their porch or in a yard, and I bring a chair, and I sit in the sidewalk, and we have wonderful conversations, and we can use technology as well to stay in touch. But I don't think we're at the time yet where we should be bringing lots of different family groups into our houses, using the bathroom. I think that is something that is a little bit too risky at this point in time. On a selective basis, however, maybe one family with one family, maybe a grandparent unit with their kids who have been distancing, and everybody has been healthy, and nobody's been exposed to known COVID, and people have no symptoms for a 2-week period of time. And especially if somebody happens to have antibodies present. That's not a guarantee, but it adds another factor. Maybe we're at the stage in time where we can mix a bubble and extend that bubble. I think we're about at that point in time, but it has to be done very carefully, and it has to be with the understanding that nobody has any symptoms. The minute somebody has symptoms, it's dangerous. We know you can have transmission of virus without symptoms. Asymptomatic transmission is what got us into so much trouble originally. And we didn't know that, but now we do know that. But certainly, a simple cough, a new cough, to me, that's a presumptive diagnosis of COVID till proven otherwise. And anybody with a new cough, anybody with new GI symptoms, they shouldn't be that week mixing the bubble. Wait and see what happens. 2 weeks after the start of the symptoms. So if you're really symptom-free, and everybody's been careful, wearing masks, no inappropriate social mixing, I think we're about at that point in time where we can mix one bubble with one bubble and create a single larger bubble.
Thank you, Dr. Glatt. Dr. Sharma, this one's for you. So a lot of people, as our poll showed, are reluctant to get back on an airplane, even though it's summer vacation season. What if I want to take a driving vacation, which sounds safer if I'm with my family? Is it safe to go to a hotel? And what about the beach?
So all great questions. First and foremost, any travel, you have to look at what the location you're traveling to requires in terms of quarantine. And we've seen people get into trouble when they've disregarded those rules and regulations of the localities that they visited. I think travel is going to be challenging. Airplane travel has always been fraught with spread of disease within the airplane, and people traveling, whether for business or for pleasure, you certainly don't want to get sick at all. You don't want to get sick away from home, and especially you don't want to get sick on vacation, right? So all those play into this. And while I do think airline travel can be done safely, it will be very challenging to do that. It will require a significant effort for us to get to that point. Once we see that it's really a low level, close to zero of COVID in the community, then airline travel is completely as safe as it was prior to COVID. Taking a road trip, certainly a good way to get out of the area and go someplace. Hotels, I'm sure that there's concerns about what surfaces you can touch, what you can't touch. People can certainly bring their own wipes and disinfect the rooms and then not have maid service while they're there to reduce exposure. I don't think we're going to see significant transmission from, let's say, a clean room, a clean hotel room, to the guest in that room. But having said that, what do you do once you're at the hotel? Where are you going? What are you doing? And those, to me, are the bigger questions. It's not so much the room you're in as it is who's around you, what's in the hallway, are you going to the swimming pool? Those are the bigger questions. So I think from a vacation standpoint, the beach is a great option. I think you can socially distance on the beach. It's outdoors. There's ability for you to enjoy the water, enjoy the sun, get some relaxation, and still be safe. And so I think that's a very good option for many people, especially on Long Island where we have miles and miles of beautiful coastline. So.
Very good. Dr. Sharman, I'll go away yet. I got one more for you, and this is related to the part of the poll where we saw people were, thankfully, willing to come back for a routine medical visit with their physician, a little bit less willing to come to the emergency department. You've talked about people who didn't get COVID, who were going to be hurt by COVID because of their reluctance to seek medical care when they needed it, when they were having serious symptoms. Can you just talk a little bit about what we've done in our own emergency room here at Mount Sinai South Nassau to try to mitigate?
Sure. As I mentioned previously, that the ED does advanced triage, which is the protocol where they receive patients outside of the physical emergency department. And the purpose of that is to screen for any symptoms that might be related to COVID. If a person has a symptom that's suspicious of COVID or has any contact or reports any contact or travel that might put them at risk for COVID, those patients are taken to a separate area of the emergency department for care. And they get the care that they need, and at the same time, patients who are coming in for other reasons that are unrelated to COVID are able to get the care they need in a safe environment. So we certainly have gone through great lengths. The ED is divided into separate sections, and there are sections where we treat patients who have COVID, and the rest of the sections are patients where we treat everyone else. And so we have geographic distancing built into the emergency department.
Thank you, Dr. Sharma. And we are also testing anyone who comes in for a procedure within 3 days of arrival for COVID, so we know who's potentially positive. All right, I think we're up to the last question for Dr. Glatt on antibodies. And this is from one of our Facebook followers. I tested negative. What exactly does that mean?
So this is the million-dollar question right now. If I could give you a definitive answer to this, it would really be very helpful for many people. So antibody tests have been fraught with difficulty. Some of them just weren't good. The FDA allowed anybody to say they could do one and were allowed to use it. And they withdrew 29 of them from the market about a week ago because they just weren't good tests. That doesn't mean that you should be suspect of every antibody test, but people that got those finger prick antibody tests originally, I'm not sure what they mean. Some were okay, some were not. But people that got tests from major laboratories or from hospital systems, those laboratory tests are good if they're positive to definitively state that you have in fact been exposed to COVID and your body had a response, an immune response as measured by an antibody. I wouldn't get too caught up in the titers. I would get idea of whether you're, quote, positive on the test and you measured have antibodies versus negative. You don't have any antibodies. A positive test done by a very good laboratory is a very good proof that you really had COVID. You may not have known it. You may have been totally asymptomatic, or you may have known you had symptoms, or you may have actually been diagnosed and been told you had COVID with an actual COVID test. As long as, thank God, you've recovered, even if you're not fully recovered, if you have antibody, you probably, keyword there is probably, are not able to transmit COVID or get COVID again right now. All we can say is right now, the immediate future. I cannot tell you, the official CDC position is we cannot state what that will mean 6 weeks from now, a month, 2 months, 5 months, next year. We have a suspicion, keyword there is suspicion, that the antibodies are protective. But you can't take that to the bank. You can't rip off your mask and say, I'm Superman and I can do whatever I want because I have antibodies. We don't know if that's true. And therefore, we recommend that people with antibodies still put on a mask, still practice social distancing. As I mentioned before, in a bubble situation, I would much rather mix with somebody that had antibodies than somebody that didn't have antibodies. So it might be a useful piece of information, but I wouldn't mix with them if they were sick. I wouldn't mix with them if they had symptoms of COVID, even if they had COVID in the past, because we don't know yet that it's not COVID again. It probably isn't, but we don't know that for certain. So I would be extra cautious until we had a little bit more information. There is no reason for everybody to rush out and get antibody tested. There's nothing wrong if you do get antibody tested, but it's not something that's a high priority. If you haven't had a known exposure, you've been very good, especially older people ask me this question all the time. I've been perfect for the last 3 months. I haven't left my house. I have no exposure to anybody. The kids have done the shopping for me. They leave the stuff off at the door, and I bring it into the house. I haven't encountered anyone. Well, you're not going to be antibody positive. So to go get a test to show that is not necessary. But people that had either symptoms or they have had exposures and would like to get an antibody test, any one of the Mount Sinai practices can get you that test. You can go online, see where your closest Mount Sinai practice is, and get an antibody test if that's what you would like. I don't recommend that everybody run out to get one, but if you think you've been exposed, there's nothing wrong with getting an antibody test and then using that information, whether it's positive or negative, very carefully. A negative test means you are going to most likely be at risk. Small percentage of people with a negative test actually have antibodies. We just can't detect them. But assume for practical purposes a negative test means you could get COVID. And assume for practical purposes that a positive test means you could get COVID still. So it's not that useful yet. But I certainly have had the choice of having no antibodies or having antibodies. I certainly would rather have antibodies because they may be very protective.
Thank you, Dr. Gladden. Of course, we do have 10 locations along the South Shore where you can get an antibody test. And one of the positives, if you do test positive for antibodies, is you could be a donor for plasma therapy, which, of course, is very important and promising, shows a lot of promise. So I want to thank Dr. Glad and Dr. Sharma, not only for today, but for their leadership during the entire pandemic. They have been at the very forefront here at Mount Sinai South Nassau, and in particular from our external affairs point of view. Anytime we've turned to either of them and asked them to explain something to either a member of the public or a member of the press, they have always come forward and helped us out. So I just wanted to thank them. We're very fortunate to have their leadership here at Mount Sinai South Nassau. Thank you to our Facebook audience, and we'll be back again soon.